A 43-year-old teacher walked into her doctor's office last month with a cough. 3 questions later, she was getting a chest X-ray. 48 hours after that, they found something that would have killed her if she had waited another 6 months. Those 3 questions are the same ones I am going to teach you today. And honestly, I am frustrated that this is not common knowledge. Because by the time you finish this video, you will know exactly when a cough is just annoying and when it is actually dangerous. Hey, I want to help you understand something that could literally save your life or the life of someone you love. Let us talk about coughs. You know how sometimes you get a cough and you are just not sure if it is something you should pay attention to? I have been there too, and honestly, it can be really stressful trying to figure out when to seek care and when you can just monitor it at home. Here is what I learned that made everything so much clearer. Doctors actually look at coughs like a puzzle with 3 pieces. And once you understand these 3 pieces, you can make really informed decisions about your own health. You do not have to feel as anxious or confused anymore. Those 3 pieces are duration, how long it has been going on, features, what else you are experiencing, and risk context, which is basically just knowing your own health background. Let me start with duration, because this is the one that helped me the most. If you have had a cough for a few days, or even a couple of weeks, that is often totally normal. I know it is annoying and uncomfortable, but post-viral coughs can genuinely hang around for a while. Your body is just doing its job, clearing out all that inflammation and mucus. But there is a specific time frame where doctors typically start to look a little closer. 8 weeks. If you are an adult and your cough has been going on for 8 weeks or longer, that is when it becomes what is called a chronic cough. Now, I do not want you to panic if you are at that point. It does not automatically mean something is wrong, but it does mean it is generally worth getting evaluated, just to make sure everything is okay, and maybe get some relief if you are really struggling with it. Every major medical center, places like Mayo Clinic and Johns Hopkins, they all use this 8-week mark as a clinical threshold. It is not random. It is based on years of research about what causes coughs at different stages. And here is the really important part. Sometimes you do not need to wait 8 weeks. There are certain signs that doctors consider more urgent, and I'm going to walk through those with you so you know exactly what to watch for. Okay, so let us talk about the things that, if you notice them, are generally worth bringing to your doctor's attention sooner rather than later. I do not want to scare you. I just want you to be informed so you can take care of yourself. The first one is if you are coughing up any blood at all. Even if it is just a tiny bit, even if it is just a little pink tinge in your mucus, the medical term for this is hemoptysis, and it is something doctors typically evaluate promptly. Now, does it always mean something serious? No, absolutely not. It could be from a bad respiratory infection. It could be bronchitis. There are lots of possibilities. But it is one of those things where it is better to get it checked out and have it be nothing than to wait and wonder. You deserve that peace of mind. The second thing to watch for is what doctors call clustering. And this one is really important because it is easy to miss. So, a cough by itself? Often not a big concern. But if your cough is showing up with other things like you are feeling way more tired than usual and you cannot figure out why, or you are losing weight without trying, or you have lost your appetite, or you are getting short of breath more easily, or you are having chest pain, that combination is worth paying attention to. I know it can be hard to tell sometimes if something is really a symptom or if you are just having a rough week, but if you are noticing a few of these things happening together and they are sticking around, it is worth having that conversation with your doctor. That is what they are there for. The third thing is if you keep getting chest infections that either will not fully resolve or keep coming back, especially in the same area. Like, you finish your antibiotics for bronchitis, you feel better for a bit, and then it is back again. Or it never really clears up completely. This can sometimes mean there is something else going on that is making it hard for your lungs to do their job properly. It is definitely worth discussing with your doctor. And the last one is if your voice has changed, and it has been staying that way for more than a couple of weeks. Persistent hoarseness, or just your voice sounding different. Your voice box is really close to your airways, so changes there can sometimes signal that something is happening in your respiratory system. It is commonly included on symptom checklists because it can be an early sign that is worth investigating. I know this might feel like a lot, but remember, I am sharing this with you so you can feel empowered to advocate for yourself, not so you will worry about every little thing. All right, now let us talk about the third piece of the puzzle, which is understanding your own personal context. And this is where your age and your health history come into play. So here is something I want you to know. If you are 40 or older, some guideline-based clinical systems recommend being a bit more proactive with certain respiratory symptom patterns. And there is a good reason for that. In some guideline-based referral systems, if you are over 40 and you have a cough you cannot explain, plus even one other unexplained symptom, like fatigue or chest pain or shortness of breath or weight loss, those patterns often lead clinicians to order imaging sooner rather than later. Now, I want to be clear about something. This does not mean that if you are 40 and you have a cough, something bad is happening. Not at all. What it means is that the statistical probability of certain conditions changes as we get older. So the medical system is designed to help you get evaluated a bit more promptly in these situations. And if you have ever smoked, even if you quit years and years ago, that is something your doctor needs to know. It does not make you a bad person, and your doctor is not going to judge you. It is just a piece of information that helps them provide better care. The same goes for if you have worked in jobs where you might have been around asbestos, like construction or shipyards. That exposure matters, and it is worth mentioning when you talk to your doctor about any respiratory symptoms. I know sometimes we do not want to bring up these things because we feel embarrassed or we think we will be judged. But your doctor really does just need this information to help you. They are on your side. And here is the good news I want you to hear. In many cases, chronic coughs are caused by things that are totally manageable and not dangerous at all. Now here is the part most people do not expect. In many cases, chronic coughs are caused by things that are totally manageable and not dangerous at all. The number one cause is something called upper airway cough syndrome. That is just a fancy medical term for post-nasal drip. You know that feeling when you have allergies or a sinus thing, and it feels like there is mucus dripping down the back of your throat? That triggers your cough reflex constantly. It is really common. It is super annoying, I know, but it is typically not dangerous. And once it is identified, there are lots of things that can help, from allergy meds to nasal sprays to other treatments. The second most common cause is asthma, especially a type called cough variant asthma. With this kind, your main symptom is coughing instead of wheezing. Your airways are just extra sensitive to things like cold air or exercise or allergens. And the good news is, once you know that is what it is very treatable. Most people feel so much better once they get on the right medication. The third big one is acid reflux, or GERD. Sometimes stomach acid comes up into your esophagus, and it can absolutely make you cough. And here is the thing. A lot of people with this do not even have heartburn. The cough is literally their only symptom. If this sounds familiar, it is worth talking to your doctor about, because it is really manageable once you know that is what is going on. There is also medication-related coughs. Some blood pressure medications, especially ones called ACE inhibitors, can cause a dry cough in about 10 to 20% of people who take them. If you started a new medication and then developed a cough, definitely mention that to your doctor. They can often switch you to something else and the cough resolves. And of course, if you smoke or you are around a lot of second-hand smoke, that can definitely cause a persistent cough. Here is what I want you to take away from this. If you can explain your cough, like you just got over a cold, or you started a new medication, or your allergies are terrible right now, that context really matters. it usually means the situation is less concerning. It is the unexplained cough, especially when it comes with other unexplained symptoms, that typically deserves a closer look. So let me put this all together in a way that shows you how clinicians typically think about coughs. When you are thinking about your own cough, ask yourself these 3 questions. First, is my cough explained or unexplained? Do I have a sense of why I am coughing? Did I just have a cold? Did I start a new medication? Do I have obvious allergies acting up? Or is this happening and I really do not know why? Second, is it just a cough? Or are there other things going on too? Am I also dealing with fatigue, weight loss, shortness of breath, chest pain? Or is it really just the cough by itself? Third, what is my personal health context? Am I over 40? Have I ever smoked? Have I been exposed to things like asbestos in my work? Again, no judgment here. These are just factors that can be helpful for your doctor to know. Based on your answers to those questions, here is what I would encourage you to consider. If you have any of those features we talked about that doctors tend to evaluate more promptly, blood when you cough, infections that keep coming back, voice changes that will not go away, or several unexplained symptoms happening together, it is worth reaching out to your doctor. You are not being dramatic. You are being informed. If you have been coughing for 8 weeks or more and you cannot really explain why, even if you do not have those other features, it is generally a good idea to get it evaluated. The workup is usually pretty straightforward. Maybe a chest X-ray, maybe some breathing tests, maybe just reviewing your medications. But you will have answers, and hopefully some relief. If your cough has a clear explanation and it is not clustered with other concerning symptoms, monitoring it at home is often reasonable. But if it is really disrupting your sleep, or making your life harder, or just not getting any better, it is still totally fine to talk to your doctor about it. That is what they are there for. And one more thing I want you to know. Sometimes your cough reflex can kind of get stuck in a heightened state even after whatever caused it is gone. Doctors call this cough hypersensitivity syndrome. So even a cough that does not seem that severe might still be worth getting help for if it fits the patterns we have talked about. You know when something feels different for you. If something feels off to you, it is okay to seek care. Your concerns are valid. So, duration, features, and risk context. Those are your 3 puzzle pieces. You have got this framework now. If this helped you feel more confident about understanding respiratory symptoms, I would really appreciate if you would hit the like button. And if you have questions, drop them in the comments. I am here for you. Take care of yourself, okay? You deserve to feel well.